I want to say good evening to everyone who has joined us tonight. Welcome to our first BYC for the year, Boost Your Confidence webinar. And God has really helped us and brought us to the year 2025, and there's a lot in store for us. I want to thank you for being part of the LCI family all throughout last year. Thank you for being part of all our webinars and our BYC testimonials. I believe that you have gained so much. My name is Dr. Uri. I'm a lifestyle medicine physician and a family physician and the founder of LCI. Lifestyle Champions International is a community where we raise like-minded individuals who are passionate about making healthy choices every day in order to prevent lifestyle-related diseases. And so a day at a time, we make healthy choices and trust God, to keep us hale and healthy. So we're going to start right away. I know many other people will be joining us as we go along. So I'll be recognizing more people as they come in. However, we have in the house with us tonight a very special person. She's a mother, she's a grandmother, she's a lifestyle professional as well, passionate about healthy living and also posture management. So I'm going to introduce her shortly, but as you come in, please, you can just introduce yourself in the chat box. Tell us your name and where you're joining us from so that our speaker can have an idea of who she's going to be speaking to tonight. So our speaker is Mrs. Modupe Adesanya. She's a physiotherapist. I think I should actually pin her. Let me see if I can, so that you can see her face, spotlight her. Yes. So I'm reading your profile, Ma. So
Good
Mrs.
evening,
Modupe,
everyone.
yes, so Mrs. Modupe Adesanya is a physiotherapist. She worked with the National Orthopedic Hospital Igobi for 35 years and retired notoriously from service as a deputy director. She's a specialist in orthopedics, musculoskeletal therapy, and geriatric care. She's a born-again Christian, and she's a member of the Full Gospel Businessmen's Fellowship International. I'm also a member, and so we work together in that fellowship. She's also a youth counselor at the Chapel of Christ Our Light, University of Lagos, Akoka, and she's a grandmother. Please join me to welcome with much joy Mrs. Modupe Adesanya. You're welcome, Ma. Thank you for honoring our invitation. Thanks for being here tonight, Ma.
Thank you very much, Dr. Ore. Thank you, everybody who has joined. You are all welcome, and I pray that we'll have an exciting time tonight. Thank you for inviting me to this program. I'm grateful.
Yes, Ma. So as we had shared earlier in all our invitations and reminders, we're going to be looking at this important topic. And I know that many of us are already familiar with, certain forms of exercise. We talk about aerobic exercise, we talk about brisk walking, we talk about skipping, we talk about dancing, and many other forms of aerobics. But there are some other forms of exercise that some of us are not really conscious of. And we're supposed to include those exercises into our day-to-day activities. And that's why today we're going to be looking at core muscle strengthening and optimal posturing. How do you strengthen your core muscles? How do you maintain an optimal posture? I'm sure you will notice that as people age, they tend to bend forward, they tend to slouch, they tend to sag. Is there anything we can do, to maintain our balance, to still stand straight? That some people at 90, they're still standing straight. What makes a difference? So you're going to have the opportunity to ask our expert here, all those questions. So she's going to be talking to us over the next 25 to 30 minutes about core muscle strengthening and optimal posture. So over to you, Ma.
Thank you very much.
Because
can you see my screen clearly?
Very clearly, Ma.
Okay. So, as has been introduced, our discussion tonight will be on core muscle strengthening and optimal posture. When we say core muscle, what are we talking about? The core is the center part of our body. That means the most important part that holds every part of the body together. We are talking about the trunk, the pelvis, the low back, the hip, and the abdomen. These are the parts of the body that aligns us. When we are talking of body alignment, all this has to be put together, and the muscles that do all this has to be in good shape. If they are not in good shape, then we'll have a problem. The core muscles are crucial in overall strength, stability, and balance, which will eventually result to good posture. Weak core muscles can lead to pain, instability, and reduced mobility. I here listed some muscles. We don't really need to know their names. But why I put this slide there is, when we look at our back, it looks like one junk muscle, one big muscle, or the stomach looks like one big muscle, but they are not just one single muscle. The trunk is made up of, is supported by several muscles, and the abdominals are so many. For instance, we have the rectus abdominis that helps us to bend forward, provide support for the spine. Then can you still see my screen there?
No, Ma.
Sorry.
I think a call was trying to come in and took you off.
Yes. I'm trying to come back. Are we back now?
Yes, Ma, we're back.
Okay. Sorry about that. The transverse abdominis, they are the side muscles that keep the spine in place. So when you turn, your vertebral bone are not shifting from one side to the other, obviously, or moving. So they keep the muscles in alignment. No matter what movement you carry out, all these muscles keep the wow.
Sorry, Ma. I think someone is trying to call frantically.
I'm trying to handle that, sir.
No problem, Ma.
Okay. So we can even skip all this. Just know that the trunk, the abdominals, the back muscle, they are not just one single big muscle. They are made of several muscles that support the spine. Now, what causes weakness of the core muscle? What do we do? When God created us, He created us well. And as we grow, our muscles increase in size. And as they increase in size, they increase in strength. The energy of a child is different from the energy of an adult. So As we are growing, the muscles are growing with us. But at what point do we start having that weakness? Do we start having that change that can affect our lives, our posture, and our well-being? So what are those things that affect us so much, that bring about these changes? Number one, sedentary lifestyle and lack of exercises. When you sit in one place for a long time, regularly every day, what you don't use, you lose. That is the principle of muscles. If you don't use a muscle, you start getting weak. So when you live a sedentary life, know that you are signing up for weakness of a lot of muscles in your body. Poor postural habits. If you like sitting slouch, sitting anyhow, then you will be causing a lot of pressure on certain parts of the core, of the spine, as against the other. There will be imbalance. So that poor posture that you are assuming will be weakening a lot of muscles in the body. And those are the muscles that are mostly affected with poor posture are the core muscles. The core muscles are what keep you upright. But by the time you start changing the position, they start overstretching at one end and shortening at the other end. So eventually there will be weakness and imbalance. Pregnancy and postpartum changes are another thing that change or weaken the core. You can imagine a pregnant woman. The tummy was made at, a certain size, but with pregnancy, they start stretching out to accommodate the baby. So as the pregnancy is advancing, the muscle stretch is also advancing. Then after delivery, what happens? Yes, the baby has come out. The muscle will reduce in size, but they'll never get back to the original size if we leave them unattended to. But if we attend to them, you can see that somebody who has even carried multiple pregnancies can go back to the original size with exercises. But without exercise, definitely the muscles will be weaker. And all those muscles are the pelvic muscles, the trunk muscles, the lower abdominal muscles, the pelvic floor muscles. They will get weak. Then injury, something like an accident that happened that affected the hip or the vertebrae. Such injuries, if not well managed and fully healed with a lot of exercises to strengthen the muscle back to shape, injuries will cause weakness of the core muscle. And finally, like we all know, as we age, just like even material things, for instance, you buy a clothes, it looks so sharp initially. With use, you see that clothes starts changing color, start changing textures. It's exactly the same thing with human body. Increasing age stretches us out, especially with a lot of challenges, emotional, degenerative changes, hormonal changes. Aging is able to naturally weaken all our core muscles. What are the signs that my core is weak? How do I know that I have weak core muscles? Once the core muscles get weak, the upright position is now in question. We will not be able to keep the upright posture. So naturally, we'll begin to slouch because we want to compensate for the weakness. We are looking for a way of escape. Instead of sitting upright, because of the weakness, you start adjusting to a stronger part of your body to compensate for the weakness. So slouching and poor posture will tell you that, oh, your core is not as strong as it should be. Then low back. When you start complaining of low back without accident, it's not that, oh, you did something that actually injured your back, but you saw that, okay, now if I sit for 10, 20 minutes, I have low back. Or when I'm walking, my back aches. Know that you need to come back to strengthen your core muscles. Instability or declined coordination. What do I mean by that? When you are walking and you see that you are not as stable, some people will start buckling the knee when they are walking, or they start falling. Know that the core muscles are in have been what is the word now? Have been compromised. Once instability sets in, then coordination. You are walking and you see that the normal movement that is smooth is no longer as smooth as before. You have to watch your steps, deliberately watch your step before you can take the other step. That happens a lot with the elderly, but it's still as a result of weak core over the years. Protruding abdominals. When your tummy is now bulging, especially after childbirth, like I said, your tummy is no longer flat. You now have protruding abdomen. They will say you that you are a mother of three, you are a mother of four. That's why don't mind. You are not a single girl. No, your tummy can go back to the original if your core are strong. So that's another sign that you have weak core muscles. Bladder leakage. Some people, once they cough, you see that some urine is jutting out of the vagina. Some don't even have to cough. Any little gathering of urine in the bladder, they start leaking. They can't get to the toilet before they get wet. That's a serious indication that the core muscles have been seriously compromised. Vesicovaginal fistula. That happens a lot with children who gets pregnant, and during labor they have strained. I mean, they strained their pelvics, the vagina during labor, because their body is not mature enough for the process of child delivery. So all the contents of the pelvic start falling out into the vagina. This happened mostly in the northern part of the nation. When I was a youth corper, I served in Niger State, Bida. For the whole year, what I treated as a physiotherapist was vesicovaginal fistula. You see 13, 12 years old being brought to the hospital. And what is the problem? They have married them out to one Alhaji who slept with them. They get pregnant, but during childbearing, because their body is not mature enough, everything just falls off into the vagina, and even sometimes falls out of the vagina, and they have to now pack it with their hand and push it in. Unfortunately, the allergies will leave them and go and marry another child, cause another damage, and still move on with his life. So such a sorry case. Another sign is difficulty in performing basic movements. I've mentioned that while I was describing decline coordination, but even apart from that, basic movement like staircase climbing becomes difficult, becomes painful. Then you know that the core has been, the core muscles have been is now very weak. So sorry, I tampered with. Okay, sorry. Okay, so those are the signs that your core muscles are weak. Other things that show core muscle weakness is when people start having difficulty in sexual activities. What do I mean? Either the man is now complaining that over there is very weak, very loose, it's not as tight as before, or is the woman that is feeling, oh, I can't even feel that anything is there when you are with your husband. It shows that the core is very, very weak. And that's a serious thing that we need to work on, especially we women. When you are meeting with your husband and you can't feel that tightness again, it's a serious indication of weak pelvic muscles. You know, in the outside world there, they call it okpai. They will tell you that okpai, meaning that, okay, when men complain of back pain, or a man is unable to really perform as he should, they will tell you it's jedi jedi. It's not jedi jedi. It's weak core muscles. As it can happen to women, so can it happen to men. If you strengthen your core muscles, a lot of those things will naturally fizzle out. So how do I get to this strengthening of the core muscles? How do I strengthen my core muscles? They are very simple. The core exercises are numerous, so numerous, but I'll just give you a few that even this few, if you practice it, you'll be good to go. Number one is the plank or full body engagement. Some people call it press up, but it's a little different from press up. Can you see my screen and the pictures I'm showing?
Yes, ma, we can.
Okay. How do you do this? You put, first of all, assume the prone position. When you assume the prone lying position, then bring your elbow right under your shoulder. Your elbow right under your shoulders. Then you lift yourself up from the elbow. And you can see the position of the feet. Don't let your feet be in what's it called now? In extension. The feet has to be in flexion. I mean, the ankle rather, in dorsiflexion. Can you see the ankle that is bent, is bent forward? What do I mean? The shoe is not looking out, looking back, it's looking forward. Did you notice that? Am I making sense with what I'm saying?
Yes, ma. Go ahead, ma.
Okay. No, it's very important to note the position of the feet. That, you know, I can lie like this with my feet looking backwards. If you do that, you'll be putting strain on your ankle. So when doing this exercise, we ought to ensure that the shoe or our feet, if you are not wearing shoe to do it, is not looking backward. It's rather you are resting on your big toe, the first layer of the joints. You are resting on the first layer of the joints. I don't want to use medical terms because I know that people here are various disciplines. Then we have the bridge exercise, which helps in strengthening the low back and the buttocks. For this, you lie flat on your back, then bend your knees with your arms by the sides. Lift your hip up just as it is in the picture. You can see the picture. But I want you to note the key point about all these positions, because the position really counts in these exercises. The palm is facing down. It's not looking up or looking sideways. Keep your palms down. Your feet flat on the floor. What I mean, your knees are bent, but your feet are flat on the floor. Then you lift your hip as high as you can. It is not in one day that you can get to the highest point, but gradually, as you keep doing the exercise, you keep getting better at it. Then the Kegel exercise. The Kegel exercise is just like what I just showed you as the bridge exercise. But I want to talk a little about Kegel exercise. If you are doing Kegel exercises, when you get to the highest point, you have to count at least up to 10 before you bring it down. You lift as high as that. For bridge exercise, just lift up and come down. They both have effects, but one is an extension of the other. Bridge exercise, once you lift up, you have achieved the highest height you want to get, then you come down. But for Kegel exercise, when you get to the highest point you can get, they start counting 1, 2, up to 10 before you bring the hip down. Then you repeat the exercise as many times as possible. Let's say for a beginner, for 5 times. Then you can progress to 10 times. That's Kegel exercise. Then there is another Kegel exercise that you can do. It's not something that I can show. That one has to do with when you go to toilets and you want to pass urine. When you get to toilets, you release some of the urine and stop. Tighten your buttocks as if you don't want to allow the urine to come out again. Then you release a little more and stop. You can stop like 2-3 times before you eventually let go of all the remaining urine in the bladder. That's a form of Kegel exercise, and it's also very good for the core muscles, especially the pelvic floor muscles. This is cycling crunch. What you do in this position is you lie flat on your back. Then, cycling in the air. I'm sure a lot of us know cycling in the air, but this is a little different. You bring adjacent limbs. Like that means if you bend your right knee, you take it to your left elbow and allow them to get as close as possible. If they can touch, that means you have very strong core muscles. If they can't touch, keep practicing until you are able to touch. If you are bending the left knee, it will go to the right elbow and vice versa. So you do this up to 10 times, which you can do about 3 times a day. But if you don't have that much time, you can just break it at a go into 10. You rest a while, then do another 10, then another 10, making at least 30 in a day. Otherwise, you do like 10 in the morning, 10 in the afternoon, 10 at night. But I know that a lot of us don't have that kind of time. We devote a particular time, either in the morning or in the evening, for exercises. And when you are doing, make sure that you do minimum of 30 in a day, but you can do as much as 100, meaning when you allow the right knee to touch the left elbow and you go up like that, you rest a while, you repeat it 10 times, and you repeat it another 10 times and another 10 times. With that, you have very strong core muscles. Dead bug. The picture speaks for itself. It's almost what you do with the cycling crunch. Alternate leg and knee. So you stretch the right leg and bend the left leg while you stretch the left hand. Okay, how do I explain it now? When you are lying flat on your back, one hand is above your head, you stretch it backwards, while you use the other hand to almost touch the knee of alternate side. Right hand touching the left knee, right knee touching the right right hand touching the left knee, and left knee touching the right hand. Is that clear to us?
It's
Hello?
clear, ma.
Yes.
Yeah. Okay.
Yes.
Yeah. Thank you.
Bird dog. We can see the picture. In this case, the important point that I want us to note is that the arm that is on the floor, try and align your wrist to be directly under the shoulder. Can you see? The shoulder, the elbow, and the wrist must all align on a straight line. Not that the arm will be a little forward beyond. I don't want a slant arm. I want a straight line arm, a vertical arm. So the shoulder, the elbow, and the wrist are all on a vertical line. That's the arm that is resting on the floor. Then the knee joints and the hip are also directly under what the knee joint is directly under the hip. Can we see? Can we note that? You can see the other picture of the pink lady here. Can you see?
Yes, ma'am.
Okay. What she is doing is not what I'm recommending. That's why I put it there. You can see that her knee is not directly under the hip. Did you notice that? You have two pictures or three pictures here. Okay. You can see the right picture, the smaller one, the pink one, the pink lady there. Can you see?
Yes.
Her knee is not under the hip. Did you notice that? It's slanting backwards. It's more posterior or more backward than the hip. But when you are doing the bird dog exercise, your hip and your knee has to be right in line. The knee has to be directly under the hip. Then you stretch the alternative limbs. If you are stretching forward the right hand, your left leg will be stretched backwards. Then when you change, make sure that you align the knee under the hip before you stretch out the arm and the leg again. Does that make any sense to us?
It does, ma'am. It does, ma'am.
All right. Then, like the pink lady, when we have advanced this exercise, we have mastered it well, we can now introduce something like a dumbbell, like she is doing, but we have to ensure that we are well aligned in doing it with our own dumbbell. Leg raise. For somebody to be able to do this and have the leg right up, your core must be very strong. But you won't get to this level all in one day. You can start with as high as possible. Just keep the two legs straight and lift them up. Lift the two legs up at the same time. Continue to practice this until you can get to this level that you can have your two legs right straight up, that the knee, the ankle, and the hip are all in one straight vertical line. Can you see this man? The ankle joints, the knee joints, and the hip joints are all on one straight vertical line. But like I said, we won't get here in one day. But start as much as you can do. Lift both legs up as much as you can. Then ensure that, like maybe weekly or bi-weekly, you increase the height you can get. So when you increase the height, if you sustain it for like 2 minutes, you bring the legs down, you do it again, ensuring that at least you maintain the first height that you got to. Then the next time you are going to do it, you should ensure that you either increase the length of time that you sustain that height, or you increase the height that you attain. Let me come again on that. You know, your starting position is lie flat on your back with your arms by your side, the palms looking down. Then you lift the two legs up. You might not attain this height of lift in one day, in 1 month, but whatever height you can get to, when you get there, count up to 5 before you drop the legs and repeat several times, like 10 times. But each day you do it, you either increase the number of time, the length of time that you are holding that height. Let's say you are able to lift up to like 5 inches. You can't go beyond that. That 5 inches, you count up to 10, or you hold it there for about 2 seconds. The next time you want to do it, if you can't go beyond that height, you hold it for more than 2 seconds. You hold it for, let's say, about 3 to 4 seconds. That is an improvement on the first one. Then your aim is to increase the height. When you have mastered that level, then you go a little higher. You might not maintain the same length of time at that new height until you are able to actually come fully like this. With this, you know that your core is very strong. And when I mean your core is strong, your abdominal muscles are very strong. Your hip muscles will be strong. Your pelvic floor muscles, that is the muscles that holds all the organs of the body in, like the uterus, the bladder, those organs within the pelvis, all those the muscles that are holding them in place, they are very strong. So by the time you are able to get to this level, your core is extremely strong. Now, what is the importance of having this strong core? Like we said at the beginning, they are the muscles that keep us upright. So this will bring us to the second part of the discussion, which is the posture. We said optimal posture. But before you can have an optimal posture, the beginning is to be aware that you need to have a good posture, which is postural awareness. A lot of people don't have that awareness. They sit anyhow, they lie on anything. When they are walking, they use all kinds of shoes that are not comfortable, managing to walk with this, especially ladies on high heels. If you see some people walking on high heels, you'll be begging them, is it by force? Because we are doing a lot of damage to ourselves because we are not aware of our posture and the importance of it. So why is postural awareness very important? They say knowledge is power. When you understand that whatever you do to your body has a consequence, then you'll be careful on what to do. So understanding posture prevents certain health issues like degenerative changes. What do I mean? What is the cause of degenerative changes? When they say a bone is degenerating, it means that you have not been using that bone in proper alignment. You have been putting pressure on one side as against the other. And the point at which you are applying much pressure, we start to wear off. We become, we start wearing out. It's just like a tire in a car. If you don't do alignments, what happens to your tire? One side of the tire will be wearing as against the other. You see one side is still looking very okay, while the other side has worn off. So that is what causes degenerative changes in the bone. So if you are not conscious of good posture, you will just be causing degenerative changes in your bones. And once that starts to happen, then you are calling for a big problem. Like if you are not conscious of your sitting, you are sitting slouched, you'll be putting pressure on certain parts of the spine. And that spine, number one, you will be overstretching the muscles around that certain parts of the spine as against the other. While some of the muscles are overstretched, the others are not in use at all or understretched. There's no balance and there will be wear and tear. When we are aware of our posture, we'll prevent pain, malalignment, and instability. Postural awareness helps maintain independence and mobility in old age. What do I mean by that? When, as a young person, you have kept it in your mind that you must sit properly, you must lie on a firm mattress, because even your sleep posture counts. Your standing posture matter. Your sitting posture has to do, everything has to be proper. If you are aware of this from the beginning of your life, your old age, by the grace of God, we know that human being, we can only try. It is God that keeps people healthy and alive. But at least your own part, you have done your own part to ensure that in old age, you are healthy. What do I mean? You see a lot of people in old age, like Dr. Ore said at the introduction, they are bent forward. You know why that happens to a lot of people? Number one, the force of gravity is to bring everything down. That is the effect of gravity. Everything must come down. God made us erect people. So naturally, we are working against the forces of gravity, the force of gravity. And that is why we say the core muscles are anti-gravity muscles. So if you don't keep your core strong, they will not be able to overcome the effect of gravity. They will just be following the order of gravity, bringing you bent forward. So to prevent all that in old age, being bent forward. And once you bend forward, you know that pain is inevitable because degeneration will start. And what is degenerative changes? Arthritis. I want us to look at the pictures of this man that is walking either on the phone or on the pad. Can you see the neck? Look at the neck in the first picture where it is marked X, the first line of everything he's doing on that, the first line is very wrong. Look at the neck, look at the back. It's better to bring whatever you are doing up to eye level. When you bring it to eye level, the strain on the neck will be minimized. That is the right one marked blue underneath the first one. When you sit as close to the end of the chair to maintain a straight back. If your chair is too long, a lot of chairs designed these days, they imagine that everybody is an American. The seats are very long. When I sit on them, my leg cannot touch. For my leg to touch, that means I will have to slouch my back. Instead of that, have pillows stuck in between you and the chair, in between your low back and the chair. But for this one, he has adjusted the laptop or whatever he's working on to be as close to him as possible. And that is elevated by pillow or stand. You can see he has put something under the laptop to draw it near so that he is not bending forward. And the last one, you can see the laptop stand doing the work for him while he's keeping his back straight. So when we have to be aware of this, not only in sitting, even in standing. You see some people when they stand, they can't stand erect. They have to lean on something or assume one posture, one limb is straight, the other one is bent. And you see that such people, they are never balanced. They will keep changing. It's because they are looking for comfort level. But it's better to have trained ourselves to be upright. When you sit with your back well supported and your legs, ensure that your legs is right on the floor and you are comfortable. You are not bending over, you are not sitting on your back. And your neck is also well supported when you sit. When you are working on laptop, ensure good ergonomics, that the height of the chair and your table are in good order. I don't know how to, because there is no standard height for human being. Every individual has to know the best height for yourself with the table you are going to use. So the chair and the table must have good ratio in order not to keep you straining either your neck or your back. Sit perfectly, your back well rested, and your neck should be able to work at eye level under any condition that you are working. So good ergonomics, working ergonomics, especially in the office for those of us that are desk people. Ensure that the table and the chair are in right proportion, that you are not straining your neck and you are not straining your back when you are working in the office. What are the causes of poor posture? We've said it. Weak core muscles, sedentary life, slouch, and prolonged sitting. I want to talk about prolonged sitting. That's one of the reasons why our core can be very, very weak. If you are in a job that keeps you sitting for a long time, I'm appealing to you this night that Don't sit more for more than 30 minutes before you get up. Get up, take a walk, stretch yourself, and come back to your seat. That's walking in between engages your core. Unlike when you just sit, and you discover that when you sit for a long time, you start assuming different sitting postures because your core will start complaining. Then that complaint will make you to adjust and start slouching. Instead of slouching, once the body starts telling you, I need adjustment, get up, take a walk. By walking, you are engaging your core muscles. Inadequate footwear. If your shoe is tight, don't walk with it. Don't use it. If it's not comfortable, don't use it. If you have experienced brand new shoes, you will discover that you don't want to walk a long distance with brand new shoes because the pain will keep you adjusting your stance, your gait pattern. You start walking with funny gait pattern. People looking at you will know that this is a brand new shoe. Well, how do we now deal with that? Once you buy a brand new shoe, don't take long walk until they are soft enough to carry you for a long distance. So you use them for a short distance until they are stretched enough to be able to take long walk. Otherwise, get another footwear if your shoe is uncomfortable. Then for men, if your shoe have started wearing off at a side, the heel, it's better to take it to a cobbler. Let them balance the heel instead of you to continue to use it like that. Those are the things that put us in bad posture. And with bad posture, we'll begin to have health challenges like arthritis and all that. Faulty chair and workstation, I've talked about that. Then soft or sagging mattresses, that is our sleep posture. Once your mattress takes your shape when you sit down on it, it's time to throw it away. Your mattress should float you, whether you are sitting or you are lying on it. The moment you lie on your mattress and it depresses before it comes up again, that mattress is not good for you to use. So your mattress should keep you afloat in good alignment, because the lower the mattress gets is a stretch on your muscles. Like you can see in the picture. See the stretching on the spine of this lady. Especially look at the middle picture, the lady that is lying down. You can see the stretch on the spine because the mattress is sagging. But if you look at the first one, the sagging is not so much. It's almost keeping the lady afloat. And that is how our mattresses should keep us afloat. Then our pillows. Don't use bulky pillow. When you use a very big pillow, you put strain on your neck muscles. And that will affect your spine, your neck and cervical spine. So it's better to use a pillow that keeps you in alignment, almost flat. Bulky pillows are not good. So don't use bulky pillow. Look for a pillow that will just align your head and your shoulder. It's just a support for that small hollow between the head and the shoulder. Something that will just fit into that space without tilting your head sideways. Any pillow that tilts your head sideways is putting stretch on your neck muscles. Then our lifting habits. Can we look up to that man that wants to carry something? That's not the way to carry. When you want to carry something, it's better you kneel down. Not fully kneel down. What I mean, bend your knees towards the load. Let the load be as close to you as possible. That is not indicated in this picture. Let the load be as close to you as possible. Take it with both hands. Draw it close to your chest and get up by extending your knees, not extending your back. Don't bend to carry something which is a natural habit for a lot of us. You want to carry something, you just bend you bend your back to carry. Don't bend your back. Bend your knees. Be as close to the weight or to the load as possible. Carry the load close to your chest before you start getting up. And when getting up, get up by extending your knees. Stretch your knees up until you come to the upright position with the load. Consequences of poor posture. I'm sure we've been discussing that along. Chronic back and neck pain, scoliosis or kyphosis, depending on what posture you are assuming. If you have very weak abdominal muscles, the central lady will be your posture with time. You will discover that you assume a kyphotic posture. You bend forward. But if you like slouching, sitting down on one side more than the other, you might end up with a scoliosis posture. Then another consequence is what we have been talking about, arthritis and joint strain. Then reduce mobility. Once arthritis starts, the pain will not allow you to walk a lot. You now assume a sedentary lifestyle, which we started with, because you are avoiding pain. And once you are discouraged from movement, the quality of life starts dropping. Poor self-esteem and confidence setting. What do I mean by that? Once somebody does not have good quality of life, depression will set in. You want to go out, or you want to pick something, it's difficult for you. Then you will be going to live a dependent life. You need somebody around to help you out. You can't move. You want to go to the market. You feel, I can't walk. From the car park to the market is too long. It's such a distance. So you are looking for somebody to go to the market for you. You live on first floor. Something is downstairs. You are calling somebody you are dependent. And once you start living a dependent life, the quality of life, all those cardiovascular inefficiencies will set in. Diabetes is calling on your phone. So we need to actually ensure that something as simple as a flabby abdomen, flabby tummy, can lead to high blood pressure. You won't believe it. Why do I say that? Once the abdominal, like we said, is one of the core muscles. Once the core muscles start getting weak, agility start reducing. You can't move. You are not as agile as possible. There is a sad story that I want to quickly chip in. A bus got involved, caught fire. A bus caught fire. Everybody was running out. There's this woman that could not run out of the car, of the bus. Number one, she's seated at the back. Number two, she didn't have that agility to run out because she has already developed arthritis of the hip, arthritis of the knee. She was burnt to death in that accident just because she doesn't have that agility anymore. May that not be our portion in Jesus' name. So I'll soon be rounding up. I know I've spent my time. What must I do? Start now to exercise. Don't wait beyond tomorrow. It's night now. So from tomorrow, begin your exercise program. begin to exercise your core muscles. I'm going to give you 2 simple core muscle exercises that you can do even if you are a lazy person. You are lazy to do exercise. I'll give you at the end of this. They are not in the pictures. I couldn't find any picture that I can display for those exercises, but they are simple to describe. I will describe them. So start now. 2, be mindful of posture, like we said before, throughout the day, at work, at home. You are cooking, stand upright. Don't stand slouched. Keep upright. Perform the right core strengthening exercises the right way. I was emphasizing on the position of the arm in relation to the shoulder, the hip in relation to the knee. They must be well aligned for you not to use the exercise to even cause more damage. If your starting position in exercising is not right, you might be damaging the muscles. You might be causing more stress to the muscle if the starting position is not right. So, like I said, align yourself properly before you start the exercise. If the hand, if the wrist must be under the elbow, or elbow under the shoulder, let them be well aligned. Otherwise, we'll be straining ourselves. And that is why some people will tell you that they have a lot of muscle soreness after exercise. Yes, exercise gives soreness, but it shouldn't be too much that you can't continue. If it's too much, you can't continue. Your starting position for the exercise were not correct at the beginning. Then, in the office, use ergonomic furniture, the right measurements, right chair with right table height. The height of the chair and the table must enable you to work without stretching your neck or your back unduly. Then share this knowledge, educate other people, let them know what it is all about. Correct your children when you see them slouched. Correct your spouses. Encourage everybody in the family to keep an upright position. When you are buying furniture in the house, have ergonomics in mind. What I mean, be conscious of posture. Don't buy furniture for the beauty of them. Buy functional furniture that will keep everybody upright. Knowing that not everybody in the house have the same height, you have to buy furniture to suit everybody. Now, the exercise that I said I'm going to give in closing, when you lie on your, let me see, continue. When you lie on your back, bend your knees as you want to do the, which exercise is that now? Let me go back. Okay. As you want to do the bridge exercise, when you assume this posture of bridge exercise, like the upper picture, have a pillow in between your legs. Squeeze that pillow. Squeeze it and relax. Squeeze it and relax. Do 10 of it each morning before you get out of bed. You assume this posture, the upper posture of that person lying down. I don't know whether it's a man or a woman. You put a pillow between your thighs. Squeeze the pillow, relax. Squeeze again, relax. Do it about 10 times. Then when you are done with that, that same pillow is still there. Try and pull the pillow out with your hand while your legs are not allowing, your thighs are not allowing you to pull. You try and pull, hold it tight with your thighs. Don't let them go. Don't let the thighs allow you to pull the pillow out. Keep trying. Try for about 10 minutes. Only this exercise can keep your core very strong. And I hope everybody will be able to do that without so much strain. I hope I've not bored anybody. Thank you for listening to me.
Wow. That was amazing, Ma. Thank you so much, Ma. You know, as we were speaking, I was trying to pay attention to myself. I was trying to assess myself. Uri, how are you sitting? Hope your neck is straight, your shoulders, you know, maintaining the right posture. Well, that was very inspiring and educative, Ma. Thank you so much for taking time to put those slides together. Please let's appreciate our speaker. I'm sure if you see her, you won't know that she's a grandmother and she's still very active. We appreciate you, Ma.
Thank you very much, Dr.
You really did justice. I don't know if we have any questions. Do we have any questions for Mrs. Adesanya? We can put them in the chat box, or you can raise your hand.
Good evening, Ma. Good evening, Ma.
Yes,
Good
Ma.
evening.
Good
Please
evening, Ma.
introduce yourself, Ma. Introduce yourself.
My name is Arawa Antonia. Thank you so much. This is a beautiful lesson tonight. Honestly, I really do appreciate it, because if we are to attend the seminar or conference for this, I can imagine how many dollars we'll pay. Actually, I just want to appreciate the mama that spoke, and including you that organized the God bless you. God bless both of you. Honestly, God bless you. Very good, Ma. Please, Ma, how can we get the recorded version of this chat or this training? I really would love to have it, if you don't mind, Ma. I'm sorry you couldn't see my face. We don't have lights, so everywhere is dark.
I understand, Ma. This is Nigeria. So I just pasted some links, Ma, in the chat box. Maybe I should post them again. I posted our Telegram community and also our YouTube channel. We normally upload all our videos. In fact, there's some other videos that you might also want to watch that are on our Telegram.
YouTube?
On YouTube, yes, Ma. I just shared it. I just shared it now. Let me share it again.
Okay.
So you can
really
look for all our videos.
In fact, this is your own pastoral call.
Thank you so much, Ma. We really appreciate the feedback. It's very encouraging. I can see a question here. So we have a lot of thank yous. Thank you so much, Ma. Great presentation. Thank you for the educative session. Thank you, Ma. I learned a lot. Well done, Ma. Thank you for the beautiful presentation. Thank you very much for this powerful lecture. God bless you. Thank you so much, Ma. It was really informative. Thank you, Ma. Well done. So we have a question here that says, any retrieval program for those of us who are already in old age and are walking bended? Ma, do you have an answer for that?
Yes. Just start the exercises. The little you can do each day adds up. There is never a time too late to start exercise. From the day the awareness comes to you, start exercising. And for those who are bent already, I will recommend that you lie on your back with a pillow under your shoulders.
Oh, yeah, okay.
A pillow under your shoulder will push you out. You push your chest out. It won't happen in one day. You can start with almost a flat pillow, then you increase it gradually until you are able to have your full, your shoulders almost flat on the pillow. So start by lying with your upper back on a pillow. I don't know whether that I'm making any sense with that? Hello?
I think you are, ma'am.
Yes, ma. I think you've answered the question, ma.
Okay.
So we have some other questions. This is a bundle. Good evening, ma. Thanks for this presentation. This is really educational for everyone. My questions are regarding the Kegel exercise. Should it only be done when using the toilet? That's the first question, ma. Maybe you take that first.
Okay. With Kegel exercise, you can only do that exercise when you are using the toilet. But without using the toilet, I would like everybody right now to, first of all, locate your pelvis. How do I mean? As you are seated now, try and tighten your buttocks. Let's all do it. Tighten your buttocks. Don't tighten your stomach. Just tighten your buttocks. Find your pelvic muscles. Have we all found it?
Yes, ma. I'm tightening my buttocks right now.
Okay. Can you release it now?
Yes, ma.
Are we all doing that? The whole class? I need responses.
Yes, ma. Yes.
Okay.
Yes,
Now,
ma'am.
Yes, ma'am.
let's do it again. Let's do it again. Can we tighten our buttocks? Don't tighten your tummy. Tighten your buttocks. Squeeze. Squeeze. Let's count 5 together. 1 to go. 1.
1,
1,
2,
2,
3,
4,
4,
5. And let's go. Relax. This simple thing that we have just done, if you can make it a habit, that whenever you are sitting for more than 30 minutes, you have to do at least one of these exercises, like tighten your buttocks like that, tighten and count up to like 10 before you release. If you make it a habit, it becomes part of you. You will realize that you can't let go of your pelvic muscles just like that, loose like that. You can't let go. And once that becomes a habit, you have developed a very strong pelvic floor muscles. That's a group of the core muscles, just one group. Now, the abdominals now, that is very different. Now, can we all tuck in our tummy? Can you tuck in your tummy? Okay, stop. Let's take a deep breath in. Everybody, breathe in, out. One more time, breathe in and out. Now, pull in your tummy. Pull in your tummy. Can you hold it there? I'm going to count 5 before we relax. 1, 2, 3, 4, and 5. Relax. Hold it again. And relax. If you learn to hold your tummy, a time will come that you cannot do anything without holding your tummy. It's become part of you. One day, my daughter, before she got married, called me and said, "Mommy, I have a problem that I've been hiding from you over the years." I said, "What is it?" Said, "There's a problem with my tummy. I can't relax my tummy. Like, my hand, I can relax. The muscles are relaxed. But my tummy, I can't relax it." I said, "Yeah, come and show me how you can." My daughter has not only flat tummy, inverted tummy before she got married. I said, this is something that people are paying a lot of money to achieve. You have it and you think it's a problem. It's not a problem, my dear. is something you have to keep. After childbearing, when she had her first child, initially, like 1-2 months after, she said, she discovered that she cannot hold her tummy. I said, oh yeah, now start your exercise. But by the time she was 6 months postpartum, the tummy was back as it was before having her children. She just put to bed recently. She's been wanting to begin her exercise again, but one thing or the other, she has not started, but I know that she will go back to it. What am I trying to say? Let it become a habit that you cannot let loose of your tummy. It's a very good habit. It keeps your abdominals, and once the tummy are that strong that they can't let loose, your pelvic muscles are bound to be strong because they work hand in hand. Thank you.
Wow, amazing. We need to, practice this every now and then for us to get used to it.
Yes.
And I'm sure maybe we'll have to organize a challenge for ourselves on our platform. We have a platform where we usually do challenges. So maybe that will help people to remember, and form a habit. We have just 2 more questions. This question says, how do we discourage our old parents from living a sedentary life, being dependent by sending children on errands, homework, exercises? That's an interesting question. That is coming from a doctor.
That's wisdom is profitable to direct. Don't become what Emma G or Koshel. I'm talking you back. When the elderly send us on errand, let's respectfully attend to their requests, but let's encourage them to be active. It all starts by educating them. Education is powerful. Knowledge is power. If they know the importance of it, they will key into it. But if you just want to load it on them, that, mommy, do it yourself, that will sound good, and that is not biblical in any way. But when you educate them on a neutral platform, that sitting, not doing anything is not good, then help them in activities that can help them to move around. Encourage them to move around. I had a friend that lives in the US that came home one day, and she said, what is paining her in living in America is there are no house helps. Say, you Nigerians, you are lucky. I said, how do you say we are lucky? He said, a Nigerian woman will cook a cow without getting up from her seat. Say, Bọ́ládé, ṣó ti gbẹ́ran yẹn kaná? Túbọ̀ sún, ṣó fi yọ sí? When the meat is done, say, ìyá Àdìjá ṣe ti tọ́wò. She is sitting down doing nothing. She will cook a whole alase cow, àbí kí ló ti ń pè, pot, ìkòkò orin kan á sè without lifting a finger, without getting up. So we should discourage ourselves from that. Do it by yourself. Move around. Encourage them to move around. Then you can take a walk with elderly parents. Thank you.
Okay. Thank you, Ma. We have to round up in another few minutes. I can see that I think
there are
this
2 hands raised up.
Mrs. Oduniyi. I believe it's Mrs. Oduniyi that's whose hand is raised. Am I right?
I want Dupe to her hands is
you can unmute, Ma, and speak. Either Dr. Mr. or Mrs. Oduniyi. Please unmute and speak.
Hello, good evening.
Good evening.
Good evening.
Thanks, Ma, for the lecture. I want to ask you a question, Ma. Like, what kind of exercise can you prescribe for somebody that has done a series of abdominal operations?
Same exercises. Or
Yes.
okay. If that person has recently done exercise, you might not be able to do everything we have described, but start by raising the two legs up. Straight
Okay.
leg raising, both legs. Then you can do sit-ups. Your hands while lying down, coming up all the way. If you can get to your toes, fine. If you cannot, wherever you can get. Sit-up exercise from lying on your back with your arms stretched above your head. Then you sit up as far as you can go. If you can touch your toes, fine. If you can't, wherever. That would be very good for somebody who have done abdominal surgery.
Thank you, Ma. So it just goes to say that all the exercises that have been prescribed can be done by people who have done abdominal operations. It's just that the timing, you can start slow. It doesn't have to be all those exercises immediately. I'm sure the doctor will even want you to heal, and not undergo anything stressful. And then gradually one can begin to adopt those exercises. So let's listen to, I can see another hand. Dupe, please, can you also unmute, introduce yourself and ask a question?
Thank you, Doctor. God bless of our sitting position. That means we should not sit towards the edge of the chair. We should move inside very well. I want her to still talk about that one.
Yes, sit until until your buttocks touch the back of the chair. Don't sit at the edge of a chair. Sit inside the chair. And if you have chairs that you cannot get to the end and your leg will still touch the ground, it's not a chair for you to use. There was a time in my house we bought a set of settee, and I realized that when I sit on it, I either my leg cannot touch the floor, and if I want my leg to touch the floor, I will be sitting on my back, stretching my back. What I did, I just removed where I normally sit and I put a dining chair there. When they are tall in my house, I'm the only short person. So when they are sitting on the sofa, I sit on the dining chair, on the dining chair. That's what I use for a long time until we change the whole set. You have to be postural aware of your back.
Thank you, Ma. Is there any exercise that could reverse arthritis? And the last question after that is, what kind of exercise is good for someone who complains of weakness after a little walk? So those are the last two questions. Is there any exercise that can reverse arthritis? And then what kind of exercise is good for someone who complains of weakness after a little walk?
Okay, let me start from the second question. If you complain of weakness of where? Is it general body weakness? Or weakness of the legs? If it's just that the legs become weak, or generally you feel weak and tired, it's a different thing. So while we are waiting for you to clear that question, I want to say there is no exercise that can reverse arthritis, but there are exercises that can prevent arthritis. Then when we say arthritis, are we sure that the bones are already degenerated? Arthritis means degenerated bones. If the bones are not degenerated yet, there are exercises that can prevent degeneration. There are exercises that can address pain, that can alleviate the pain. But if the bones have worn out, if the cartilage of a bone has worn out, no replacement for cartilage. So no exercise will bring the cartilage back, but we have exercise that can relieve the pain. But there are two different things. There might be pain without arthritis. There might be arthritis and pain. If arthritis has happened, that means the cartilage lining of the bone has been eroded. No exercise will bring it back. But there are exercises that can reduce the pain, that can even alleviate the pain depending on the level of degeneration. But to bring back the cartilage that is lost, no exercise can do that. So we await clarity on weakness. Is it general body weakness or?
He said general body weakness, ma. I can see it here.
Okay.
General body weakness.
The person needs to actually go and do a lot of tests to know whether your PCV is low, to know whether so many things. What's your blood pressure like? When we are doing aerobics, which is different from core muscle strengthening, when we are doing core muscle strengthening, we may not need to know our blood pressure. If you are doing aerobics, you need to know your starting blood pressure. If your blood pressure is high, don't exercise, please. Or if you are going to exercise, it will be low-grade exercise. So let that person find out more about herself or himself, the blood pressure, the PCV. Go and see your doctor. Complain of general body weakness. Thank you.
Wow, this has been a wonderful time. Thank you so much, Ma, for throwing so much light on this topic. And I want to appreciate everyone who has attended and contributed to the discourse. We do appreciate you, Ma, and we pray that God will continue to strengthen you. You will always walk tall. You will never slouch. In Jesus' name.
Amen. Amen. Thank you very much.
Yes, Ma. So for those of us who have requested for the video, don't worry. There will be access, but just make sure you are part of our community. Either you follow us on YouTube or you join our Telegram community, where we usually put in information from time to time about upcoming events. So this is Lifestyle Champions International, and what we are just trying to do as an NGO, it's a foundation. We are just mindful of individuals living a healthy lifestyle, making healthy choices every day in order to reduce the risk of developing all these things that we have mentioned today. For example, osteoarthritis, diabetes, hypertension, because we know that our lifestyle can actually either trigger them or prevent them. So thank you once more for being here. I want to acknowledge one of my very senior elders in the house. She's been a mother, Dr. Jemima Ehimi. Thank you, Ma, for being here. I can also see.
Thank you, Ore. God bless you.
Yes, Ma.
Well done.
Yes, Ma. Then Dr. Ibironke Shodeinde, thank you for being here.
Thank you. Thank you.
Dr. Victoria Aladewolu, these are my elders. Thank you, Ma, for being here.
Thank you for what you are doing, Dr. Ori. God bless you for this.
Yes, Ma.
And thank you, Mrs. Adesanya. God bless you. Really enjoy your presentation.
Thank you, Ma.
Thank you so much, Ma. So we have so many other people here. Mrs. Adedunton Oyegoke, thank you for coming, Ma. Dr. Adebowale Babatunde, Adewumi Olalekan, Adewumi Oluwole, thank you. I think it was Mrs. Arewa that asked the question, or is it Doctor? I'm not sure. But thank you, Ma, for joining us. Dr. Clement Yakubu. Dr.
I'm not a doctor.
Okay.
That's a challenge.
Okay, Dr. Lani Johnson.
I'm in the law field, not the medical field. So it's you guys that have
It
it
doesn't
all.
matter. You can have a PhD.
Yes. Dr. Victoria Ladewod, she has a PhD.
Yes, I'm not a medical doctor. And please, I forgot to mention something. I don't be deceived with this number, because myself and my husband were so attentive, and I know that's how it will be. So you have more than this number, I'm very sure.
Thank you, Ma. Thank you, everyone. So many people to mention. We appreciate you. I can